Hi there. In this video, I will share a couple of important points that you must know when you are creating a CV. In fact, this is one of the most requested topics from the community of this channel. So if you have also this requested, hopefully you will find this video helpful. My name is Dr. Farzana Hoque. I'm an associate professor of medicine in the US. Let's first discuss that what is the purpose of the CV? Because you have lot of accomplishment. Maybe you are a physician, you are a medical student, you are a physician now looking for a residency or a new job. You have achieved lot of accomplishment, both academic, personal, professional. You know that how much work you have done. However, the program director, for example, the recruiter, they do not know that how wonderful you are, what you have achieved. The only way is to show that, okay, what is your education, what you are looking for, and also how you will be successful in that role only can be communicated through CV. So CV is a wonderful way to express your accomplishment, your mission, as well as what you are able to contribute as a candidate in any job or any residency position. And this purpose of the CV can be multifold, such as you may be writing a CV to reaching out to a physician for an observership, an externship, or maybe you want to do research. Either way, you need a CV. So let's first focus on what are the sections you must have in a CV. First and foremost, definitely you know that it need to be start with your name, your address, your contact information. You do not have to always include your cell phone number. However, you must have to include the email address, which is professional and expected. So the number one tips will be always make sure your email address is professional. For example, it should contain like your first name, last name, then whatever the email account you are using. Not be fictional like rockstar@gmail.com, something like that, because it need to shows that you are professional. First, the tips is keep your email address professional. So after the name, contact information, the next section should be coming one line, like what is the purpose of this CV? As I have already mentioned that, okay, you may be writing the CV to get an observership or to get an externship, to get a research position. Truly, it depends. So whatever it is, the teaching tips number 2 is that you should have just one line mentioning that, okay, what is your goal? For example, you maybe want to get a research volunteer position, something like that. And truly the beauty of this one line is that it is communicating very clearly and concisely that what you are looking for. And if your goal has been changed, maybe you were looking for research position, now you are looking for an externship. You can always change it. It's just few words. So the next tips will be, what is the next section after that? In my view, it should be education. And the education section, I want to clarify so that all the questions has been answered. First, the education, I do not think that always you have to start from your secondary, higher secondary. If you are a medical student, maybe you can't include that. However, if you are a physician at your back home, or if you are a maybe physician looking for a research position, you can only mention your medical school, maybe your grade, and then which year you passed. Very importantly, make sure if you are applying for any observership or an externship in the US, and if you have done any USMLE steps, it should be there under the education. For example, if you have completed USMLE step 1, okay, now it is pass and fail. You should include which year you passed that. Secondly, for other USMLE steps, make sure to add the score as well as which year. One of the biggest question always my mentees asked me that, okay, Dr. Hoque, if my score is very low, do I need to include it in the CV? I do not think so. If your score is very, very low, because that could be one of the red flag, you do not have to include that score. You can only mention that step and which year you complete that. And after that, as an international medical graduate, IMG, you know that, okay, we need that ECFMG certification. If you have that certification, you must also include that under the education section with the year, which time you got it. If you have your USMLE step 3 or planning for USMLE step 3, you should also add it, because USMLE step 3 is truly one of the strength for any candidate. If you have, that's good, but if you do not have it yet, if you are planning for it, you can always mention that, okay, which year or which month you are planning to do that exam. So let's now change the gear. What will be the next section after the education? And that should be current experience. And this current experience could be like maybe, you are a medical assistant, you are an intern, or truly what you are doing. If you are currently not doing any clinical experience, for example, if you're not doing observership, externship, or any work, in the current experience, you can mention if you are preparing for any exam or any particular course, you can mention that under the current experience. I'm telling it specifically because, it does not look very professional if the current experience is completely blank. At the same time, we all know that as an international medical graduate, we have to face a lot of hurdles. We have to do not the exams, the visa issue. It need time to get the clinical experience opportunities. So, which is not same as an American medical graduate. So you can mention in one line that what you are currently doing. If you are doing any kind of clinical experience, either it could be in the US or in your back home, that's wonderful. Always make sure to add that under the current experience. And this could be clinical experience or research experience. Now let's focus on the prior experiences. And what are the things you can mention under the prior experience? One of the experience, which is a great asset for international medical graduates, is the internship. Because during our internship, you are seeing a lot of patients making decisions along the supervision of your supervisors, doing the co-management. So you should always highlight your internship experience. Besides that, if you have any observership or externship experience in the US or Canada, always make sure that you are including that under the prior clinical experiences. And in this section, you should mention maybe 1 or 2 lines, not more than that, okay, under which physician you may have worked for, how many hours per week, like maybe what kind of patients did you see? Was it inpatient or hospital? Was it in the outpatient or clinical setting? Are you familiar with any electronic medical record? So those kind of things should be highlighted under the prior clinical experiences. So what will be the next section under the prior clinical experiences? The next section should be any kind of a scholarship. And meaning first you should start abstract presentation, like any oral presentations or scientific poster presentations. Make sure that you are not including case presentation in the ward or in the hospital because it's not the same. In this abstract experience or abstract presentation, you should talk about if you had any opportunity to give any oral presentation or any poster presentation. And the good part is that these poster presentations or oral presentations does not have to be always in the US. It could be anywhere in the world. It could be online, it could be in person. So if you have any experiences, always make sure you are highlighting it here. So after the abstract presentations, the next section will be publications. So under the publications, you will list whatever the papers you have. If you have not published any paper, if you assisted any faculty or any researcher to do data collection, to enroll the patients, or what kind of activity you did, if you have anything, always make sure to include that. One thing I want to highlight here, as now the USMLE Step 1 is being pass and fail, one of the strength for IMG is this section, which is publication, research, presentation. So if you can at least have some publications, it does not have to be always first author. If you are first author, that's wonderful. However, it does not have to be always first author. If you can publish any paper in a part of the team, always take that advantage because it will truly make your application much, much stronger than other candidates. So let's focus on what will be the next section after the publication. The next section should be any awards, any honors. If you get any awards, honors during your medical school, during your internship, during your job after internship, you should always include that. One tips here I want to give you that you do not have to bring all the teeny tiny awards. For example, you got a award when you are age 5 or 6 during your primary school. If it is national award, if it is very big, yeah, absolutely, you can mention that. However, I will recommend to keep this award anything like at least from higher secondary to above, not much more like at your school age, unless those are very, very recognized and national awards. The next section will be volunteer because, volunteer, this section not only emphasize that, okay, you are a wonderful human being who is taking time to volunteer to help community. Also, it shows that you are an empathic person who has the heart and motivation to do work for the better for our community. So if you have any volunteer experiences, for example, if you are a volunteer in any club of your medical school where you are doing any blood drive, any medication collection drive, you can always include that. And remember, this volunteer experience does not have to be always medicine related. For example, one of my mentees, she used to teach the poor children on the weekends. So you can also mention if you have this kind of experience. The important tips here to remember that it does not have to be always medicine related because we are much more than only the medicine. Then the next section should be languages. Remember, one of our strengths as an international medical graduate is that we can speak lot of other languages besides English. And we should see it as our strength because through the expertise in multiple language, we are not able to connect with other people. Also, it improved our intelligence at a different level. So this is a strength for any IMG. So if you know any other languages besides English, always document that. You should always document your mother tongue. If you are fluent in any other language, you should also mention it, because US is becoming more multicultural now. We are getting people from many countries. So if you know more than one language, that is always plus point. One important tips I want to share here, that if you took any validated international language test such as TOEFL, IELTS, this is also a wonderful opportunity to include it here, because it shows that you have strong foundation of English language. Because remember, when you will be at your residency training, English is the language that you will use. So if you have any language, if you already did any language, had good score, you can always share that. However, I'm not telling that, okay, keep your USMLE, do the language test. If you have, that's good. If you do not have, you can always make sure to highlight that, okay, what is your truly level of the English language? And it should be truly, definitely higher than the average to communicate with the patients. So this is the overall structure of the CV. I hope it will be helpful to recap, to make sure you are able to follow all the important points. I would like to recap. First, you are starting with your name, with your contact information. For cell phone, I do not think that you have to give, but email address, yes, definitely. So after the contact information, then you are telling the one line that what is the purpose of this CV. Then you are focusing on your education, and under education, besides like your Bachelor of Medicine or like MD degree from your back home, if you are an IMG, you should also mention whatever the USMLE steps you have done, if you have your ECFMG certification or not. After the education, you should talk about current experiences. And these current experiences could be your research experience or your clinical experience. Then after the current experience, you should highlight your prior experiences. And in your prior experience, always make sure you are including your internship, because often I see that IMGs forget that. After that, you should talk about abstract presentations, and it could be oral or poster presentation. Then the next section will be publications. If you have any publication, make sure you are documenting the author list accordingly. For example, if you are the first author, middle author, or last author, make sure it is documented. And one of the tips I want to share, that APA style is most commonly used. So you can use the APA style citation for documenting your publication in the CV. Then after publication, you should talk about award, your volunteer experience, and then your language. Two other tips, which is bonus tips, I want to share, that for your stage where you are looking for a residency position, maybe you will use the CV to get any letter of recommendations, observership, externship, or research. Keep it between 5 pages, because truly more than 5, it could be too long. And if it is like, 1 page, it is just making your life much harder, that, okay, which one to include, which one not to include. I believe 5 page is truly a great number to make sure you have good balance of including whatever the important information you need to add, as well as it's not very long, because, everybody is now very busy. Nobody has time to go through the very, very long CV. So 5 pages is a wonderful number. If you document all these sections that I have advised, I strongly believe that it will be a great eye-catching CV that truly portray your credential. And one simple tips that may sound very, very expected, but believe me, grammatical error, spelling error may happen. So always make sure you are checking your grammar, spelling, because one mistakes maybe not it is visible to you, but remember, one simple mistakes can truly destroy your reputation, your credibility. And ultimately, you may just lose that opportunity by even though doing this lot of hard work by writing and gathering experience for this CV. I hope you will find this video helpful, and I truly appreciate all of you who participated in the poll and who advised for these topics. If you want me to create a video on any other topic, please make sure put it in the comment section, because as you can see, I read them very attentively, and make sure to create videos on those requested topics. I post video on every Wednesday, so stay tuned for new videos on every Wednesday. Please like this video. Please subscribe to this channel if you have not yet, because your subscription means a lot, and it also helps you to get notification for all these useful videos. Your presence is always so much appreciated, and I cannot wait to see you in the next video. Until then, take care and keep rising.